Hey guys, Alex Winter here from Blue Wave Insurance. Today we're going to talk about the top 7 questions for folks who are new to Medicare. The first question is, what is Medicare and how does it work? So Medicare is administered by the federal government and consists of 2 parts. Part A covers you in the hospital and other facilities, and Part B covers you at the doctor, outpatient services, and preventive services. Medicare is primarily for folks who are 65 or older or who are under 65 and qualify with certain disabilities. Now, other parts of Medicare outside of original A and B are Part C, Medicare Advantage plans, which take over Medicare and become primary and are offered through private insurance companies. Other parts of Medicare are Part D, prescription coverage, which are also offered by private insurance companies, and also Medigap or Medicare supplement plans, which again are offered by private insurance companies, which pay after original Medicare. So mainly Medicare is made up of 2 parts, A and B, and the other parts are optional and can be added to your Medicare coverage. Question number 2, what does Medicare cost? How much will I pay for it? So Medicare Part A is usually free if you've worked for 10 years in your life and paid into the Medicare system through your taxes that come out of your paycheck. Part B has a premium attached to it, and that amount is $185 in 2025, so $185 per month in 2025. It's important to note that that can go up based on your income. Government will look back 2 years. They can charge you more for Part B. They can also charge you more for the Part D drug coverage as well based on your income. Question 3, when and how do I sign up for Medicare? So if you are turning 65, you have a 7-month window to sign up for Medicare. This is called your initial enrollment period. It takes place 3 months before your birth month, month of, and lasts for 3 months after your birth month. If you are coming off an employer plan and starting Medicare for the first time, it's best to sign up 1 to 2 months before your employer coverage ends. That way there is no gap in coverage. So Medicare will start right when your employer coverage ends and you're not going to go anytime without coverage. Question 4, what is the difference between Medicare Supplement and Medicare Advantage? So a Medicare Supplement plan pays after original Medicare. So you'd keep your original Medicare as your primary coverage and the supplement plan will pay after. That allows you to go to any doctor in the country that takes original Medicare. Medicare Advantage is a replacement for original Medicare and would take over A and B and become primary, and you can only see doctors in the Medicare Advantage plan's network. Medicare Advantage usually includes drug coverage and dental and vision, and usually only costs $0 per month for all those benefits, whereas the Medicare Supplement plan does have a premium with it, in addition to your Part B premium, usually $100 or more per month, and you have to add in drug coverage and add in dental and vision. With the supplement plan, you can go to any doctor anywhere in the country that takes original Medicare. So even though you're paying more for that coverage, you have the ultimate freedom to go wherever you want. Question number 5, do I need a Medicare or Medigap policy? Well, original Medicare will typically cover 80%, so that leaves 20% left over. Plus there are deductibles and other costs associated with going to the hospital and a skilled nursing facility. So we recommend doing a policy if you can afford one. If you're going to do a Medicare Advantage plan, that would take over Medicare, and you cannot have a Medicare supplement and a Medicare Advantage plan at the same time. So it's one or the other. So some folks do go without either. They just do regular straight Medicare and pay the out-of-pockets. That's an option. So it's up to you if you need one or not, but it's important to know there are out-of-pockets, and the biggest exposure is the 20% on the Part B side, which is unlimited. So a policy to protect you from that exposure is recommended. Question number 6, does Medicare cover dental and prescription coverage? Prescriptions are covered separately under Medicare Part D, as in dog. You would get a Part D plan if you go with original Medicare and a Medicare supplement policy. Your other option would be to do a Medicare Advantage plan, which again takes over original Medicare, and those plans usually include drug coverage. As far as dental goes, the original Medicare does not include dental, so you'd have to purchase a separate dental plan. The Medicare Advantage plan does include dental, but remember, the Medicare Advantage is a replacement to original Medicare and takes over your Medicare. Question number 7, if I'm still working, can I delay Medicare? If you are still working, you can safely delay Medicare as long as you are actively working and your coverage is through your active employment and there are more than 20 employees, then you can delay Medicare Part B so you don't have to pay that premium. And then when you get ready to retire, you would sign up for Part B, you would fill out the form that shows you've been covered through your active employment, and then there would be no penalty for delaying Medicare. So yes, if you are currently working and are covered and there are more than 20 employees, you can delay Medicare without a penalty. If you need help with your Medicare, give us a call at the number below. We'd be glad to help you out. Don't forget to click like and subscribe below to stay updated on all things Medicare. Thanks for watching the video, and we'll see you on the next one. Thank you.